So migraine is a sometimes progressive disorder. So people begin with episodic attacks, and over time attacks may increase in frequency. There are a number of risk factors that lead to the transition from episodic migraine to chronic migraine. And traditionally, clinicians have focused on relieving pain and restoring function, and also on preventing migraine attacks. But we're beginning to get a glimpse of a world in which clinicians may also try to prevent migraine from progressing. And one approach to doing that is to look at the risk factors that have been identified that lead to migraine progression. So people with high headache frequency are at greater risk for developing chronic migraine than people with lower headache frequency. So use of preventive medication and trigger avoidance can be very helpful. There's now strong evidence that obesity is a risk factor for migraine progression, and so addressing weight loss may help mitigate pain and also reduce the risk of progression. It's quite important if there are comorbid psychiatric disorders like depression and anxiety to address those disorders. I want to emphasize, however, that clinical trials showing that risk factor modification can alter the natural history of migraine have yet to be conducted. So for migraine, we're where we were with cardiovascular risk reduction 20 years ago. We know the risk factors. We have a lot of evidence about what the risk factors do. We know the risk factors are modifiable, but there's no compelling evidence that risk factor modification will modify natural history. On the other hand, there are many good reasons to address depression and anxiety, to encourage weight loss, to decrease attack frequency, and to work hard to control acute attacks. So in a way, this provides a motivational context that I feel comfortable advocating as we're waiting for more rigorous evidence.